We'll first start with the definitions. Sterilization. Sterilization is a process by which an article is freed of all living microorganisms, including spores and viruses. Disinfection. Disinfection is a destruction or removal of all pathogenic organisms. The difference from sterilization. Good morning. The difference from sterilization is that in disinfection it does not affect the spore state of organisms. Antisepsis. Antisepsis is the process of destruction of disease-causing microorganisms to prevent infection. It can either be bactericidal or bacteriostatic. Asepsis is the practice to reduce or eliminate infection-causing organisms from entering the environment of the patient. An antiseptic agent is a chemical which either kills pathogenic organisms or inhibit their growth so long as there is contact between the agent and microbe. And antiseptic agent as a term is reserved only for agents applied to body surfaces, whereas disinfectant is a term that is reserved for use on inanimate objects. An ideal antiseptic or a disinfectant is the one which has a wide spectrum of action. It is active in presence of organic matter. It is effective in alkaline as well as acidic medium. It has speedy action, high penetrating power. It is stable, compatible with other antiseptics and disinfectants. It does not corrode metals. It does not cause local irritation or sensitization. It does not interfere with healing. It should not be toxic if absorbed into circulation, and it should be inexpensive and easily available. An ideal antiseptic actually does not exist. Mechanism of action, this is in general for both antiseptics and disinfectants. They they cause coagulation of bacterial proteins, alteration in properties of bacterial cell wall. They bind to free sulfhydryl groups essential for enzyme action, and they compete with substrates for important enzymes in bacterial cells. Various substances can have one or more of these actions, but in general, these are the mechanisms by which they act. In general, antiseptic effect increases with the rise of concentration, but alcohol is an exception. It has its maximum antiseptic activity at 70% concentration. It evaporates.
It becomes labile and duration will be less. That is the problem. So it becomes labile when they get beyond sale.
Classification of antiseptics, disinfectants. They can be classified as acids, either organic or inorganic, alkalis, alcohols, aldehydes, surfactants, phenols, halogens, oxidizing compounds, dyes, and heavy metals. I'll be discussing in brief each one of them.
So basically you are describing only chemicals and
yes. Yes.
I think you have given all the what is sterilization in that?
Yes, sir, definitely.
So what is sterilization? You know, saying everybody is that I would like to. What is sterilization?
Sterilization is the process by which all pathogenic bacteria, including spores, are either killed. Whereas disinfection. They're removed off the surface.
So that is the important word you should use when you are using sterilization. So what is antiseptic? I would like to know whether you really understand.
So, antisepsis is a process by which Um, a surface is either the pathogens are either killed or inhibited from acting. Antisepsis is when a pathogenic when bacteria are inhibited from coming in contact with
What you are saying is
asepsis.
to understand these are small but important. Asepsis means you do not allow any pathogens in contact with the hand or surface. That is what should be our aim as a surgeon. Asepsis. You understand? What is antisepsis? When it is inevitable, the pathogen will come in contact and take action against it in antiseptic. So asepsis, you wash your hands, wear the sterile clothes. Whereas when you do paint, as also painting is antiseptic. You understand? That you should keep in mind. Asepsis is a precaution. Antisepsis is the action. Because skin cannot be get rid of again. You cannot do the autoclaving of the skin. Can you? Whereas you can all instruments, labs, and even when you get the clothes, you can get it. That is asepsis. So you do not allow it. But whatever is already existing, you take precaution against it is antiseptic. So when you do painting and draping, that's that. One more point of antiseptic is antibiotics. You understand? To counter it. So the point is that you have done a good aseptic precaution. The antibiotics, I think everybody will be able to do it. So when you give antibiotics, it is used frequently antiseptic. You understand? Asepsis, antisepsis. Sterilization is a general term. It is used for all the stuff. You should understand this point. Very simple but very important. So in cooking, our aim is asepsis. That is the basic idea. But everywhere asepsis does not work. How you do the asepsis of skin of a patient? The painting and that. What does it do? Painting? What does the painting do?
So painting will like we use povidone iodine for painting followed by
I
sponge.
am not use that. I have not asked what you will use.
It will
What does the painting do?
it will either kill or inhibit all the bacteria on the surface of the skin.
What is your aim? When you do painting, what is your aim?
To achieve antisepsis.
That is fine, but how do? The basic aim of painting, if somebody asks you, is to decrease or minimize the coloring count on the skin. You cannot completely hide, but it should be decreased that much that you should go below the norm. That is the actually the antisepsis inside the whole one of the part. Understand this point. So why it is important? So which chemical you use is very important. Because we randomly use povidone iodine. Is it a really a good material? Are there better material? Or single chemical will be good, or you need to use combination. This you will understand. Right? So here you will describe all. Basically, when you describe any chemical, what you will look for? What you will look for? You say like when you use any chemical anywhere, what should be the aim?
It should not it should not be irritating the skin.
Very good. It should be behind the skin or skin there.
It should cover a wider range of organisms. It should cover a wider range of organisms. Gram positive,
Cycle. What is cycle
cider.
is very important. What do you mean by cycle?
Cider means that it kills the bacteria. Static means that it inhibits the
Yes. Static and cycle. Some chemicals neither do static nor do cycle. What they are. Suppose you take surfactant.
they act as a detergent. They will form a micelle.
So what we use soap, are they bacterial cycle or bacterial static? Neither. So So you understand? So surfactants are on its own never to be used in painting or anywhere actually in that purpose. The actual use of surfactant is because if this was the only bacterial count or how does it work? Bitter. So it is usually used on the floor or the wall of OT or to clean the OT itself. It has a very limited on its own on a certain hand or tissue. So this is how to differentiate. So when you are going to describe each and every chemical, you should describe what actually is used and what not. Continue.
Alcohols. The mode of action is they dehydrate the cells, disrupt the membranes, and coagulate the proteins.
So that is mechanism. So they are healing. Remember, the spirit is a very good bacteriophage. When used in a person, when in a concentration of 70% or around. You understand? Mechanism is fine, but the basically you should describe their secret. So they are good bacteriophages. It is useful in painting. So why they are not used? So we should use only spirit. Why we are not using only spirit? We do use spirit, particularly when giving injection. You understand? So why we are not using only spirit? Why painting and wrapping? Anybody? When you give injection, you know that we are using spirit. Why we do not use it? Again, I don't. You already define it. So for sustained decrease in the colony count, the chemical should stay on a surface and act during the time of work. When you apply only alcohol, what will it do? Yes, it will do only temporary. So its effect will last for more than 2 years, which is not sufficient. Understand? That's why alcohol on its own has no value as a paint. So why will we use spirit after poison? It is of no use. This is a ritual which has been taught by our forefathers. The previous teachers commonly used antiseptic agent for a pure iron. This was very much irritant to skin. But what is it in a pure form is a very irritant. You must see some patients even today with iodine iron develop the skin here. Pure iodine was very dangerous. So after painting with iodine, to diminish or to counter the effect, to irritant effect, it was clean washed with the alcohol. So the spirit is that. When we are using povidone iodine to clean this spirit as no. This is only ritual which follows. Understand this point? There is no role of cleaning the COVID iodine. You understand? That you should keep in mind. We are following it, but it has no effect. And if you are iodine, it was a different.
Examples of alcohols are ethanol, methanol, isopropyl alcohol. Ethanol in 70% was used as skin antiseptic. It does not have any residual action. The commonly used spirit is isopropyl alcohol. In addition, it also has a degreasing action and it is more potent than ethanol. And it is used in a 68 to 72% weight by volume concentration.
That's it. Always remember this is around 70% maximum effect. But again, you are with us, but you do not increasing action.
Decrease.
So it's very live temporary action. So for a longer duration, it has no value. You want to use for injection, every injection you want to give it for. So understand that is the reason why we for a skin painting we use poison iodine, for a healing injection we use alcohol. Alcohol is better than iodine for a very short duration. Why healing injection? Alcohol is better. For a longer duration, painting is better.
Sanitizers are commonly a combination of isopropyl alcohol and ethanol, sometimes combined with quaternary ammonium compounds. Quaternary ammonium compounds are surface active agents. Next group is aldehydes. Aldehydes commonly used are formaldehyde and glutaraldehyde.
This you understand only this one?
No, sir. I have.
Because remember, this is very important. We are very commonly using this organism, all organisms, this chemical, because this is very important. There is no value on patient or a subject. That is the one point which we have no value. environment. Understand this point. So that's why this is very important. We are very commonly using this.
Mode of action is they are active against amino group of protein molecule and they precipitate tissue proteins. Formaldehyde is a gas at room temperature. It is commonly used as a 40% weight by volume aqueous solution with methanol, which we commonly call as formalin. A 4% solution is used as a preservative. A 10 to 30% is used as a disinfectant.
What is preservative?
The preservative is the histopath specimens that we send
So
for.
means missing a chance. So we know first year. So it's very simple. You make it very simple. So understand the difference. That is a 40%, result is 4%. Why? Another important point. Here is your mechanism action comes in. What is mechanism of action?
So it precipitates the proteins, right? Combining with amino group.
Using a 40%, it distort the
Cell structure.
understand this point. Many times we do not understand this and we have a very high concentration of formalin inside the tissue, in the tissue container. And we use the properties for extract. So this is for all first year particularly. Understand this. The use of formalin which is for a cleaning of protein is not same what we put in. We do not understand this and make a mistake and then we blame pathologists. You are not given proper support. How can it? Because if it is putting a very high concentration formalin, it will happen that the tissue protein, we have to see in the histopathology, will be distorted and actual report may not come. So this is the important point, very small point of all specific understanding. Why? Because it is not, it is easy to blame histopathology every time, but it is not there for many times. So understand this point. So now next time when you put in a formalin inside, take 1 minute and decide I will do proper thing or not.
A 10 to 30% solution is used as a disinfectant. Formaldehyde gas is produced by heating the solution to a high temperature or from tablets. And it does not damage metal, plastics, or fabrics. Glutaraldehyde, 2%.
So okay. So how do we use formalin? Can you mention it?
No,
Using it is an important part of your. So where do we use 40% formaldehyde or formalin along with alcohol?
so as a preservative for histopath specimen.
Then you also we have discussed
They can also be used for fumigation of OTs.
that we should mention. The reason is it is a unique quality. Where it is produced in form of tablet or liquid, both can be there. But there it becomes labile at room tablet. And gradually it is converted into gas. So, what is normally done?
So tablets are left and the OT is closed and allowed for.
So it is there, it takes longer time to convert. So 10 to 12 hours, ideally. It is closed and the formaldehyde gas will clean the environment. So that is why the formaldehyde is a unique quality. You cannot spray gas every time. It will be cumbersome container. Whereas the formaldehyde is available in tablet. So what are the different methods of doing it? Using the formaldehyde in a as a official technique. Anybody would like to say? About ordering the yes, very good. So the basically previously how you use it previously if you leave the formaldehyde on its own, it will take a long time. So do my part. When it is combined with potassium permanganate, gas formation enhances and OD can be cleaned in the less than half an hour. 1 second of power machine, like that. So when you put formaldehyde side, it converts into gas and stay equally on throughout 4 days. So it can be again the principle is to test. This should be Other use is chamber. What is that?
Sorry, sir.
Chamber.
Chamber.
What is that? You have seen or not?
Sir, it is used for instruments.
Doctor, you must
Yes.
have seen it, but it is gynecologist.
Yes, sir.
What's the formula in chamber yes.
Sir, it is used for instrument sterilization of instruments.
So should it be
Sir, it is not. Sir, it will not cause proper
no?
sterilization.
Again, you are it does for proper sterilization. So any solid instrument, there only external surface required. That ordinary tablets are good. But the problem are two. It is very difficult to assess the concentration. One tablet, two tablets, three tablets. So that creates a problem. Second, it is frequently open and closed. Concentration, because what is the sterilization? Is the tablet on its own does not do sterilization. It's the gas
Yeah.
inside. So when you frequently open or gas goes out, and you have to start from zero again. So you should understand this point. When you do sterilization, it's important. Right? Another problem is amount of tablets you need to put. And duration of the time instrument should be kept inside. The one more problem of recent is certain organisms are immune to organic stress, particularly newer organisms like mycobacteria, mycobacteria abscessi, which causes MOPD, they are immune to organic matter. That's why organic method is not commonly used. It was very commonly used previously, now it should be condemned. And initially laparoscopy people used to put instrument in laparoscopy instrument inside the organic chamber, which is nobody should do now. The reason is this. Because the outside infection becomes very common, particularly because of the frequent use of organic chamber without properly keeping the concentration of formaldehyde inside.
Glutaraldehyde, 2% glutaraldehyde is called Cydex solution. It kills all the pathogens. It is bactericidal, tuberculosidal, pseudomonacidal, virucidal, and fungicidal. The shelf life of Cydex is 14 days. It causes disinfection within 10 minutes and it is poricidal within 4 hours. And an advantage of Cydex is that it does not damage lenses, cementing material in endoscopes, rubber, plastic, and metals. And it is also used. It is used for sterilization of surgical instruments.
Again, how do you use it?
So Cydex solution is prepared, and
So when you take a water, how does it come? What is the concentration in water? Or airport.
mm,
So basically, soluble in water is a small activator. Large chambers are available. This is probably the most favorite of your oils. They carry their, and then what they do is they carry the sample and this thing, go to the OP, there they open the chamber, pour in the side, put in the lens. After half an hour or so, you do the procedure. Of course, 40 days are very important. After that, the activator goes off. So after that, it is not moving, but that is the way they use it. There is an activator as well as water. When you prepare the Cydex, it should be prepared fresh. Though shelf life is 14, that is a but it should always be prepared fresh. Second point is that it should be in proper concentration, which is never done. The point ideally you should measure, and 2% is big. Why 2%? In 2% it will be better. If it is more than 2%, it will damage the plant. If it is less than 2%, effect will not be there. Second, it should be changed every time sterilization of instruments is done. So it is very important. Right? So people used to cut corner. Okay? That is the in today's scenario, again, Cydex is going out because of this. It is not possible to cut. You understand? Then you are given this, you list of gas, then you give the chemical sterilization.
Sir, I have one slide on ethylene oxide.
But you have given it or not?
So list of gases I have not mentioned.
But remember, in this scenario, that is the most important sterilization. Similarly, have you included the radiation?
No, sir, gases and
That is
radiation.
another important. Those are very important to today's scenario. Sterilization and
Gamma.
these two are the last we will discuss. But take this in mind. So with the good availability of PTO, this neutraldehyde and formaldehyde is going out. Understand this point. Because why they were common to they were very healthy. Because we can take care of every life different and use the surface. Because these all are in a replacement of where you cannot use for okay. You understand why we use cycles? It is a rapid method of sterilization. You don't need autoclaving, and auto things are destroyed or damaged by autoclaving. Then you use cycling. But if you circumvent all this, it can be used for any purpose. That's why if somebody asks you for such type of sterilization, video is only problems are two. One is the instrument is cumbersome, costly, if you are going to see it. It's not a portable instrument, right? And it should be only one time use. Another important thing is that this thing most of them came up with laparoscopy and everything. So initially when they started manufacturing the material was such which cannot be automated. Nowadays, all the instruments that come up, most of them are automated. Also, other companies, for example, I think Watson also have found something called sterile. Again, it's a UV radiation, a small freeze-like instrument, which almost has nothing. It uses hydrogen peroxide and UV for sterilization. So, both the things, we have improved the technique of sterilization also, we instrument, we are much better, and then even where our way was. It is very popular in today's COVID scenario. UV sterilization. The same principle is applied in sterile. Again, it's a not about portable, you can do mass sterilization and single use sterile. You know that we have watched sterile here in our routine. How many people know that there is a sterile instrument in our routine?
No, मैंने
There is one.
कैसे पता चल गया?
It's a freeze-like small thing, UV sterilization. The cost is around 27 lakh. Okay, continue.
The next group is phenols. Phenols act by causing cell membrane damage, releasing the cell contents and causing lysis of cells. All spores and most viruses are resistant, and it is extremely irritant and corrosive to skin. Examples of phenols are phenol and phenol related compounds. So phenol is the one that is the most irritant and corrosive, and therefore it is not commonly used. And instead of that, Lysol, Crisol, and other related products such as chlorophenols and chloroxyphenols are used.
Yes, phenol on its pure form is useless. It does not work for sterilization. It should not be used. So what are the uses of phenol? So what are the uses of phenol? That is fine. We have got a better tool for that, but yes, you are right.
So phenol is used in combination.
Again, even in a pure form, it is not used. That's why she is going to describe it. In a Lysol and Crisol. Yes.
So in hemorrhoidectomy, it was used with almond oil for
It is a very
in hemorrhoids.
type of solution, and it was used for a
So it was in a combination with almond oil. It was injected in.
so it is used for a hemorrhoid purpose as a injection. Other place it was used is yes, you are right. Perfect. Where? Yes, for celiac cloth and even chemicals to help. What is chemical? Previously, phenol was used, now we use alcohol. That's a different thing. The phenol was the initial structure which was used for chemicals to help from neurolysis
Carbolization of appendicular stem.
carbolization. And what it was causing complications, so it has been avoided that now. But that was the various uses of phenol. But phenol is pure form nowadays.
Cresol is less toxic and it has a wider margin of safety than phenol. Lysol is basically Cresol with a detergent or a soap solution.
So, on its own is not going to clean the whole thing. It is using combination with surfactant. That what is soap solution is surfactant. So, is surfactant, what is called lysol or phenol, and they are used for a cleaning, like a strong soap.
Chloroxylenol is a chlorinated phenol, which we commonly known as Dettol. A 1.44% is used for preoperative skin preparation, and a 6.25% can be used as a disinfection of surgical instruments.
So, it is only for cleaning. It is condemned not to be used on instrument. Why? You yourself have written the answer.
So, it is irritant.
No. Dettol is your irritant, don't say. We are talking about Dettol. Dettol company वाला irritant. हमें आठ one में is an irritant. You have written answer. And you can say answer which you have written there. You have used not these things. That's why initially I was verifying about what are the various, what is disinfection.
So disinfection is that it kills the pathogenic organism but does not destroy the spores.
So we cannot. As simple. It is to be used only for cleaning of instrument. For using second method of study. You should understand this one. So Dettol is for hand wash and this. All this surfactant make it very mild. So it is not used for though it is used for cleaning. The word disinfectant is proper, but it has no role.
Chlorhexidine, it has a wide range of action, fast action, and it has residual action, and it is a common component of
Very
Savlon.
good. So keep this mind. So what is chlorhexidine? This you should know because Savlon is very commonly asked in the table and they will ask you what is Savlon? Then question will come. Is the combination of chlorhexidine with
Cletrimide.
go back now. So you should know what is the effect of chlorhexidine and what is the role of stacking. So what is chlorhexidine?
So chlorhexidine is a phenol derivative, as in it is a phenol derivative.
But pure form?
No, sir, chlorinated phenol.
Again, it's a chlorinated mineral phenol form. But understand, so we take advantage of phenols and as well as stacking. That's why Simon has become very popular. So we mild or the dilute the effect of phenol and extend the effect of saccharide. So saccharide is comparatively milder one, stronger one. All of these come together and we use the solvent. But remember, chlorhexidine is a phenol derivative in combination with this.
Savlon is a combination of chlorhexidine, cetrimide, and isopropyl alcohol. Cetrimide it is a quaternary ammonium compound, which is detergent. A 1:100 concentration storage of previously sterilized
So
equipment.
before that, you should know how to in what concentration solvent from commercial. Then you can dilute. So understand, saccharide is the derivative ammonia, is a surfactant type. It is a milder, whereas the chlorhexidine is stronger. And you use in a different combination. You can call why the Savlon has become very popular. Why Savlon is very popular?
So quick action. Action is fast.
Fast. One is not only faster. It is a range of in action in a different concentration. That is an important one. Other things can be used for one purpose, either cleaning surface or sterilization of the instrument or so and so on. The solvent in a different concentration can be used for many purposes, starting from a dressing of the wound, cleaning of the skin, sterilization of the instruments, and so on. That's why it is very important for us. someone from in commercial cricket, I think 3%, or 7, I don't know exactly, I forgot. You have to read it. But that is the bottle comes in that. So ideally, it is not used in that one. Because one concentration salmon has no value. Because it has to be diluted according to the use, which we never do. That is the problem. It should be ideally done. What we have to do not time is that is the problem. And that's why we do not get required or desired action. So you should understand that's why we are taking this lecture. So next time when you use the salmon, think of this.
1 is to 100 concentration is used for storage of previously sterilized equipments, swabbing, and aseptic management of burns. 1 is to 30 solution is used for cleaning of dirty wounds, and 1 is to 30 solution is also used for scrubbing, emergency disinfection of clean instruments, in which the instruments can be immersed for 2 minutes. The next group is halogens. Iodine, it inhibits protein synthesis and it is used for skin disinfection. And chlorine is used in hypochlorite or chloramine form, and it is also effective against viruses.
Just sorry,
Yes.
but I also want to go back one slide. Sorry. Yes.
So,
Disinfection, it doesn't get rid of smoke. Salmon. It does. It does. If it is used in a proper concentration, it can be. I think this is something we have to please be verified. It's not proper. Whatever we taken, because it can be used in
sir, I think that is with respect to immersion for 2 minutes. As in, if an instrument falls down in the OT and you
Yes.
need it again,
But
you
yes,
just
it
immerse
can
it.
be used like a glucuronide also. Very high concentration of salmon. Each instrument kept for half an hour and sterilize. That will get rid of bacteria, viruses, also. Understand? I don't know exactly, but I forgot the concentration, but you should read. It can be used for sterilization. Rock instruments are different. One more misuse is one more misuse. Everybody nowadays I think it is not there anymore. What is cheaters for?
Cheetles.
What is that?
So cheetles it is used to for aseptic.
Everybody has seen cheaters for?
Yes.
Who has not seen cheaters for? So yeah, everybody has seen. Should you be using it?
Sorry, sir.
Should you use cheaters for something only? Never, ever. It should not be. It is to be cut. So what is the solution in cheaters?
Sir, it is Savlon. Yes.
But again, it should be a high concentration, which is never active. One, it should be changed every 6 to 8 hours. We are keeping it for 15 days. In the chalk, what we used to call it Ganga. So it is there for every day, it sterilizes everything. So the disadvantage of children's faucet is salmon itself can get infected. It is because the potential of salmon goes away and we go on putting the children inside. And what is the principle behind children's faucet using it?
The principle is that if we need to lift any instrument or
So it is a sterile transfer of
Instrument.
everything. But when the chicken itself is not sterile, it uses. So next time, don't use chicken. So what is better way of sterile transfer?
so we can wear sterile gloves and
Answer is in OT. Circulating system. What we use is circulating system. Ideally, it should always be done by a circulating system. Chicken is just cutting the corner. And how do you use chicken for? Is there a method of using chicken for? So when you get of improvement, it should be transferred and integrated always. So the salmon should not go on should not go on instrument, should be reversed. Otherwise it may contaminate. So that is the principle. But principally chicken itself is it should not be because it is impossible to maintain the the concentration of Savlon for a longer time. One was just a TB. Somebody may ask, you have seen chicken spots in water, right? What else is there in water? You get the cover, now senior secretary. What is bottom? Or you can call cat at the bottom of the water. What? What? So cheetah when repeatedly goes inside, it directly can damage the water. So there is also the layer. That is the reason actually it is again the cause of a loss of sugar. You understand? So why can't you use a plastic water? Why do you use always glass water?
So cheetahs, it is a heavy instrument. It will.
So maintain the gravity will be very difficult one. And second, ideally when you use a transparent glass bottle, you can see the solvent concentration. That was the principle. Nowadays, somebody in exam will ask you something. So keep that in mind. You should, all of you should know what concentration solvent is available commercially, what are the different concentrations which has to be made, and how to make that. It is a little bit of, similarly, one more question. Here you can see that pure hexene 7.5%. What is written in bracket?
Volume by volume.
And in strong citramide, what is
Weight by
so what is difference? Explain to the first year.
Sir, weight by volume is that 16 grams of cetramide per 100 ml of solution.
Yes.
And volume by volume is that a chlorhexidine solution, 7.5 ml of solution in 100 ml.
One is gram. Understand? I have seen examiner asking this. What is the difference? It's only measurement difference. You can change the concentration. So understand W of E and D of E. You should be understanding this point. Right? Okay. So this is, I'm not going to detail. Okay. Next.
The next group is halogens. It includes iodine and chlorine. Iodine inhibits protein synthesis and it is used for skin disinfection. And chlorine is used in hypochlorite or chloramine form. And it is also effective against HBV and HIV viruses. Iodine is the oldest and most widely used antiseptic. It is used for pre-operative painting of the skin and wiped with spirit after 2 minutes. Alcohol increases the permeability of iodine, and iodine spirit is the best preparation for painting. It kills 90% of skin bacteria in 90 seconds. The iodine form that we commonly use is povidone iodine. It is a combination of iodine with polyvinyl.
90% what happens to 10%?
Sir, that is circled by residual action of the.
So that is what you should understand. Decrease the colony time. Does not completely remove. That's why it is difference between antisepsis and
This.
this what? Nobody. Have you seen the advertising of various Dettol soap,
99.
What do they do?
It kills 99%.
Huh?
Sir, it kills 99%.
You see the photograph? One or two germs are there after use of product. This is very important. This is just make you remember like that. This is very typical. So never kills everything. So obviously Dettol like the not like that much good. Otherwise we should be everything or first year we heard Sapo did to a form. But this is just to compare.
Povidone iodine is a combination of iodine with polyvinyl pyrrolidine. Polyvinyl pyrrolidine is a surface active agent or a detergent. And povidone iodine advantages is that it is water soluble and it is stable and non-irritant. Glucose iodine is an aqueous solution of iodine in combination with potassium iodide. Mandel's paint is a combination of iodine with glycerin and iodine tincture.
There is another thing you should learn. What you write down, search it and know it. So what is Mendel's paint? Anybody? No, no. Yes, Prithvi, tonsil power. So thought and tonsil when they used to use it. Again, as an antibacterial, but that was used because of basic, that was minor, soothing effect, that was previously it was minor. Nowadays, nobody uses it, but you should keep in mind. Ah, okay.
The two concentrations of iodine tincture with potassium iodine combination.
What about what is concentration in povidone?
Um,
What is the amount of iodine and what is used in povidone iodine?
so povidone polyvinyl pyrrolidine.
What is that?
So that is a quaternary ammonium compound. It is a surface active agent. It gives detergent action
Again
in
the same.
combination.
So basically, you have to understand almost all combination on the surface. Almost always. The one action is it dilutes the potency. So the irritant effect goes away because as the soaps are sodium. Surfactant forms the form. It improves the penetration of actual ion. Right? But when you rub it, the surfactant will create a form and make the bacteria come out. That's the point of controversy. Should you rub or not? That is another point. It's a wider, not a topic. We should understand that. Ideally, whether you should paint or a rub. What is paint? Ideally, it should not be good. It should be a gentle rub. You should not rub very vigorously. You will make the bacteria come out from the pores and inside. So that is not good. Surfactant makes the bacteria available for iodine to kill. Concentration, I don't remember, I cannot remember at my age, but you should know the concentration of polymethyl and iodine inside polymethyl. Right? What was the percentage iodine used for iodine cell in past? Yes, I don't know, because I don't remember percent, but you should know that is another point. I have used iodine, even using iodine in our residency. So Ovion was not there at that time. So we used to use iodine. 2% or I don't remember, sorry, not coming myself. What is meaning of tincture? You have to tell. That's what I mean. What you write down, you should know. What is tincture? Usually multiple substances together for a combined effect. Usually the tinctures are used for a surface or for a gargle.
So there are two concentrations. Weaker concentration can be used for gargles as well.
Yes.
And
So tincture is ideal for using for a gargle rather than anything else. Again, the principle is same in soap. That's why the Mendel paint and everything is. You should know this part, right? Glucose iodine is not that important when we are discussing this topic. It's a diverse, so I'm not going there. Okay. Uh, 5%, 10%, it is not only that, you should know that. 5%, 10%, even 2.5%, 7.5%, there are various combinations available, which combination you should be using. And somebody said, what, that is the important word, so it is a commercial, what is potassium? Again, it is a variant of iodine with that. Here the concentration is reversed. But the surfactant you use more, iodine you use less. There it is. Then you can use it for a, because it should be taken in a form. That is the principle. So in beta stuff, go and see what is the concentration of actually surfactant and what is the concentration of iodine. So beta stuff should not be used on a unsurfaced cell. Very minor form and can increase the problem. So beta stuff is specially used for this purpose. There is a controversy whether you should use beta stuff for painting or not. I have said that point that it will bring out for
dyes. Another next group is dyes. Aniline dyes. Aniline dyes react with acid groups in the cells Examples are brilliant green, malachite green, and crystal violet. Acridine dyes impair DNA complexes of organisms and destroys the reproductive capacity of the cell. Example is acryflavin. It is effective on wounds with gram-negative bacteria. Another example of dyes is gentian violet. It coagulates the serous discharge on oozing surface and it makes the ulcer dry. These were used previously and they're not in common use at present. Quaternary ammonium compounds are.
You are bypassing by most favorite. Similarly, there is another one,
Mercurochrome. Yes, sir. I have a slide on mercurochrome.
So every time needs to be content. Why? You ask my accident. First is there is another first is. Have you used everything or not? आपको कुछ पता और मुझे जागे नहीं आज तो लोग ये कहते हैं प्रॉब्लम one of the best agents for breast cancer. So the problem is that it is very irritant, not usually available. This is colors. It is the one other problem is color. It will stain the whole process of patient so nobody likes. But it has a use. So it is the irritant, it is a big antiseptic. Understand this point. So it looks yellow and very good. But it does because of irritant. And the infection is not much. But the granulation is not there. Because of irritation, acrylamide helps granulation. So it has its use. What is the other advantage of acrylamide and mercury? You know that acrylamide and mercury are very nowadays general practice. Very fond of using that. Why? Psychological effect. Psychological, one day you apply yellow, second day you apply red, it will be something very good in being done. That's psychological effect. Nothing to laugh, it's a very important point. Very small ulcer, whatever you think is going to be, but it gives a psychological push, right? But it can also cause the staining. But remember, I think that it should be used only when not much of infection, can the ulcer is not superficial, it is more of a tap deep ulcer, when you want it to become superficial. In those cases, treating with acrylamide can be done. It has a use like that. Gentian violet.
The gentian violet, it crusts the serous discharge. So if there is an exudative ulcer or a wound, it will cause crusting and it will make the ulcer dry.
Paint is also available. Gentian violet paint. Skin people are using that. Any use in germ surgery? Pardon? In oral also, yes. Gentian violet. Any other use or misuse?
So sometimes instead of methylene blue, it is used.
You can use for as a dye.
Fistula.
Can be used so it is not that bad. Methylene blue is this, but gentian violet and methylene blue is not available. Can be used for a fistula.
Quaternary ammonium compounds, as have been.
You will not trace the area. So, we have observed just apply reaction values. Right now, you can keep it over. It forms plastic like cover.
Quaternary ammonium compounds, they are surface active compounds or detergents which they cleanse. They form micelles around the particles on the surface and they are generally used in combination with other substances like I have described previously. One of the most common is cetrimide, which is cetyl trimethyl ammonium bromide, which is used in combination in saffron. The next group is oxidizing agents. Um, the first substance is hydrogen peroxide. The mechanism of action of hydrogen peroxide is that it produces nascent oxygen and therefore it cleanses the wound. 1 volume of hydrogen peroxide releases 20 volumes of nascent oxygen. It is not an antiseptic but a cleansing agent. Uh, the uses of hydrogen peroxide are that it destroys anaerobic organisms. It also has action against pseudomonas. It reduces frothing and it brings out the debris from areas that cannot be normally accessible while dressing. It produces heat and hence it also has a hemostatic action and it removes blood stains from linen. The next substance that can be classified in oxidizing agents is usol. Usol is a combination of 1.25 grams of boric acid with 1.25 grams of bleaching powder in a 100 ml of sterile water. Um, Bleaching powder basically contributes.
And what is on in bleaching powder and what is in cooling? What is actually these are common? What is the chemical?
In bleaching powder, we have chloride, calcium, calcium chloride.
And this one is very important. Why they release the nascent oxygen?
So because in combination they form hypochlorous acid.
How? What is the definition? You know the formula. Anybody? One is CaCO3 and CaHCl. One is calcium carbonate.
And
So carbonate when it is combined with this, release the and freeze the chlorine. What is this?
nascent is newly formed. Uh,
Final
Radi-
ideal chlorine is good. Then it is the form that is the active chlorine because it is not a normal. Normal chlorine is stable but does not create any advantage. It's a decent chlorine, but it is labile. So its reaction lasts for a very short time. That's why it will always be newly prepared and the commercially available, how does it work, I don't know. But when you should prepare, when you combine boric acid and bleaching powder in water, let it set up, so the upper part will release the chlorine and it can be used. We used to prepare in water. We used to prepare in water. Nowadays, the commercially, I don't know how much it is, but you should understand that is the principle of use. Both of the hydrogen peroxide and ozone, if it comes in contact with the atmosphere, it will react with oxygen. The chemical react will form with oxygen, so it is useless. So even if you must have had your own experience, if you keep the hydrogen peroxide water open, it becomes useless after an hour or two. Same thing happens to ozone. So unless you keep it tightly packed or you prepare it fresh, then only it is useful. Hydrogen peroxide you don't prepare, but then you have to keep it away from oxygen. It has to be tightly packed. That is the principle you should understand. The use of, and that's why the these are usually useless, but when it is freshly prepared, does. You can give a trial to your first year coming prepare it.
so we prepare it in water.
Commercially available usually has good. Okay, but you should understand this. It's important.
It releases nascent chlorine and it is useful only for 24 hours. It has to be freshly prepared every 24 hours and it acts as a desloughing agent.
This is important.
Potassium permanganate is also classified as an oxidizing agent. It is used in a 1 is to 5,000 to 1 is to 10,000 solution and it is used for mouthwash and bladder irrigation.
Commonly used for mouthwash, and again remember this word. We have said oxidizing
Agent.
what use it has. That's why it is combined with formalin and used for polystyrene. In combination of formaldehyde, it becomes more gaseous formation and spread of formalin becomes very straight and mild sterilization, effect sterilization for potassium permanganate also. This was very commonly used for mouthwash. When I was a kid, my general practitioner used to give me when
miscellaneous few slides. Mercurochrome is used in a 0.5 to 2% solution with water. Mechanism of action is that it inhibits 5-hydroxytryptamine. A higher concentration actually damages the granulation tissue because it kills the WBC cells. And but it is a lower concentration is used on wounds with healthy granulation. Sir, I actually have a query on this. Sir, uh, in patients with split thickness skin grafting with partial graft loss, we sometimes use mercurochrome.
I don't think. I don't. I don't know. I have never used it. Everybody uses it. I don't know. So you can use that. Actually, when this some portion of this it goes away, and sometimes because it's a very heavy realization, it induces electrolyzation. So after using after 2 days, we kind of a very nice electrolyzation of the
More concentrated solution can also be.
it is same. Color is very attractive,
Hmm.
mild, antiseptic, and as the sir has said, it induces the electrolyzation because of that. Then I think also use active principle is same. Induce the granulation and electrolyzation because of heat. That is the principle. So what are the causes of hypergranulation? Irritation. If there is a fault body inside, even if there is a slump inside, it gives critical hypergranulation. So we induce it. And sometimes electrolyzation is there. That is the principle. I was not using it. Right? So
Silver nitrate. These are classified in the metallic compound group. It is generally kept as impregnated cotton sticks, in silver nitrate solution, and it is kept in a dark container. It is used for cauterization of warts and in cases of hypergranulation tissue, and for dressing of burns in the form of silver sulfadizine cream.
this itself is a big problem.
Yes.
So this is a very in thing in a various form which is being used. Okay.
Sir, I just have one slide on ethylene oxide.
Yes, that is important. But just before that, I want one volunteer for a technical seminar after 50 days or something. Newer method of dressing. She has a chemical hold. The methods of dressing itself. Not like dressing. Dressing. This is important. This is a part of a dressing, but newer method. Including molecular, newer method, pure nanostructural particles, molecular hydrogen, spider web, even graft. Here, find out somebody from other disease, not from Monday, Thursday, or the rest. If nobody practice, let me know. I will assign you. But I want other people to participate.
There are two more solutions that are not included in the presentation, which we use commonly in the ward. One is turpentine. It is a mineral oil, and it is commonly used for removal of maggots from an wound.
How does it remove matter?
Sir, it causes an anaerobic environment for it causes an environment for the maggots where they cannot survive, so they tend to come out.
How does it work?
Sir, it prevents oxygen from.
So the oil is thick, it prevents the oxygen exchange. In a thinner, maggots can take oxygen. So, and second, because of its sticky nature, it reaches inside all the crevices created by maggots. So it will reach up to the maggots and prevent that. That's why the maggot will come. Second is, it's a pungent smell and irritation will force the maggot to come. Can we use our common oil for the same purpose or not? It can be used, but it needs a very large concentration for a very large time. Because the irritation is not, it is there in the right. That's why turpentine is always preferred. Always keep that thing in mind. What is the other misuse of turpentine?
Sir, it is used for removing after sticking plast the impression on the skin.
Yes. These other materials used to use for this preparation of the skin. Nowadays, it is not there. We used to do this very common, excellent to do all street art, stoma mark surrounding dirt, ether. Ether was very commonly used by us and it was giving very good. Nowadays, I don't think ether is available. It's not available, but it should be there in mind.
And another solution that we use is glycerin Maxelf. It is a combination of glycerin with magnesium sulfate powder, and it has hygroscopic action. So it is used.
What which I wanted that was a hygroscopic action. When you use in combination, it creates a hygroscopic action and sucks the fluid from the fish.
It is used for decreasing acute edema. Ethylene oxide, it has a cidal action against spores, bacteria, and viruses. It is excellent for heat-sensitive items that cannot be autoclaved, and it is highly inflammable. So, but it is used for sterilization of operation theaters. And
You have taken a very small example. Ethylene oxide is very commonly used nowadays. Very useful. The only purpose I have said is comes in a large numbers in chamber. But the most important point which we should write down here is a matter of mass sterilization. So for individual sterilization is a very costly affair. The mass sterilization is ideal. And it is all. So it is ideal. They have it in IPT and they allow people to right? It combines two things. One is the ethylene oxide chamber, and second is the covering chamber. So you need because whatever is that sterilized or will be covered or plastic or something in our platform. All the instruments are available at sea. What we have the catheter level is available. How did you like it always go and read it. Either they are all disposable things that are available, they are all EDO sterilized. Different biofilters. As far as mass sterilization, we pass each one is individually covered in the record and does not damage the instrument record. That is another important point. Remember, EPO is now a very important method of sterilization. Very important. It is not used in routine today's scenario, but this is a very important method of sterilization. Everybody should see. Now, whenever you see any disposable items, like more than 60% are like so there is only other method of mass sterilization and that is gamma radiation. Why it is mass sterilization? Here you can sterilizate everything. So the out is that you can put all the things inside the room and either pass a gamma radiation or pass a hyaluronic acid and everything is there. This is important. So many instruments they are nowadays setted by usually by rating. And even you can even select the scope also. Like being the cover it with the plastic wrapper and approximately time for the zero sterilization is about 8 hours, 8 to 10 hours. They are put in the chamber, so it's an overnight sterilization. Next morning you can take the so you are not using gamma radiation. That is one more thing. The other method of sterilization, very few are good for 1 hour, for nice. Next time